Thank you, Cavan, and thank you, Minister, for being here this afternoon. Minister, today I want to speak to you about very important and critical work that Coon Cancer Social Support and Wellness Group in Cavan Town provide. It first opened its doors back in 2012 and started in the small town of Cootehill, but has since expanded its service to Cavan Town in 2018, collaborating with Cavan County Council to provide a venue. It provides support and nurturing to cancer patients, men and women, and especially those who have come through treatment. It is a community cancer support based in Cavan Town, and this year Coon received a very small grant, although welcome, a small grant from Irish Cancer Society towards its counselling service. Minister, can I just point out to you that it's unique, I suppose, in terms of its delivery of its service, because we know so many good comfort cancer groups that provide service to patients as they're going through the treatment. However, Coon's role is to provide service to patients once they're out of the treatment, to their families as they are going through the journey. They even go as far as providing services to their families as well. So it's about counselling, it's about alternative therapies, it's about yoga classes, it's about it could be the cup of tea and the chat with somebody else who has been through. And I have to say, the founders, the ladies themselves that I've met, have all been through a journey of cancer as well. But the small amount of funding that they get from the Irish Cancer Society towards its counselling service in no way meets the needs of the cost of the service. Coon offers a range of services and which are all free of charge to the public. It relies exclusively on fundraising and the generosity of the public. And they feel, Minister, that there is no transparent, equal or fair funding mechanism for support centres across the country, such as Coon in Cavan Town. In November 2018, they got together with other services such as theirs across the country, and they wrote to the Minister, Minister Harris, in relation to this and in relation to fair and equitable funding for cancer support services like their own across the country. And in November 2018, the Minister responded and advised that centres are funded through the HSE Section 39 and lottery funding. But the reality is that the HSE areas differ throughout the country. Some are funded, others are not, and the amount of funding varies considerably and widely. All centres were advised to apply to the HSE area. Coon applied for Section 39 and unfortunately was unsuccessful. In July 2019, the Survivors' Needs Assessment was launched, and this demonstrated the ongoing psychosocial needs of cancer patients and survivors. At this time, Community Cancer Support Service were urged to apply for funding from the National Cancer Control Programme, the NCCP. Centres were asked to calculate the amount being requested based on the services being provided by full-time equitable posts. Now, of course, okay. Thank you, Minister.
Thanks, Cavan, and welcome back to tour state. What you call it? I'm here on behalf of Minister Harris, and I want to thank Deputy Smyth for raising this issue. And just listening to you, I don't know whether this response is going to actually be the one you're looking for, because I haven't read into it what you're actually looking for. The Department of Health and the HSE National Cancer Control Programme has advised significant improvement in quality of cancer services over the recent years. We have moved to a system of care, the consolidation with cancer treatment in large centres, which multidisciplinary decision-making and care, leading to better outcomes for patients. Cancer care in Ireland is provided across continuum of primary care, acute hospitals and social services, in line with the international best practice. Cancer surgery is centred in 8 designated centres. There is a clear evidence that patients who undergo cancer surgery in hospitals with high patient volume from doctors who themselves see a high volume of cases have better outcomes. As such, the cancer patients from Cavan have access to the services designated centre, P-Mount Hospital, as well as in other cancer centres, as well as appropriate radiology oncology is also provided in the hospital. At the same time, care is delivered to patients as close to their homes as possible. Therefore, medical oncology, mainly chemotherapy treatment, is delivered in 26 hospitals under the direction of the designated cancer centre. Cavan General Hospital is one of the such hospitals providing quality medical oncology care in the region. Also, an aseptic compounding unit is located at the hospital, enabling chemotherapy drugs to be made up on site. Cancer screening under the breast cancer, cervical check and bowel screening programme is also available to eligible people on a national basis. The National Cancer Strategy 2017-2026 sets out a roadmap for continuing development of cancer services for the 10 years of the strategy. The strategy places a significant emphasis on cancer prevention, early diagnosis, access to quality treatment and maximising patients' quality of life. The need for the organisations and voluntary sector psychosocial support services is recognised. In response to this, the Irish Cancer Society developed a programme of activities aimed at supporting good practice and governance in cancer support centres throughout Ireland. The programme aims to increase the collective strength of cancer support services in Ireland and provide valuable training to volunteers, managers and board members of affiliated support groups. I understand that the Coon Cancer Social Support and Wellness Group in Cavan is affiliated to this programme. The National Cancer Strategy places a renewed focus on interacting with voluntary sectors, recommending 43 of the strategy targets, increasing collaboration with voluntary organisations to develop programmes emphasising physical, psychological and social factors that affect health and well-being. Funding to secure the continued implementation of the recommendation of the strategy and the development of cancer services and programmes is being sought through the estimates for 2020. Section 39 of the Health Act 2004 makes provision for the HSE to provide access to bodies that provide service similar or alliance to services that the HSE may provide. Voluntary cancer support centres may be eligible to apply for such assistance and can only apply for the National Lottery funding through the HSE. The Department of Health will continue to work with the HSE National Cancer Control Programme and with voluntary organisations to address the needs of cancer patients in a more holistic manner. And I'll come back in on some of the issues that the Deputy.
Thank you, Minister. And you have touched in your response there on Coon itself, but I suppose to be very specific, I suppose the call here and the request is that the Minister and the Department of Health give Coon the funding they need to run their service. And Minister, it takes at least 30,000, at the very least 30,000 to run their service. They are volunteers, they do not have anything close to that, and they are totally dependent on the generosity of the public and all the fundraising events that happen to support them. But the reality of it is they're all cancer survivors themselves, actually, the volunteers involved in it, and they can't continue to do it. And I'll give you specifics. Up to 2018, their new clients was at 69, okay? After they launched their new venue in September 19, that went up to 121 clients. The numbers attending their complementary therapies carried out in September 20 went from 24 to September 19 to 139. And their counselling services also, their numbers too have jumped. They're significant jumps. You're talking about 4 and 5 times within the space of 12 months the service users that are attending their service. And the bottom line here, Minister, is funding. I have some testimonials here, Minister, and they're so, I suppose, emotive and real that I think it's important to hear these. One such testimonial is, a cancer diagnosis is just devastating and life-changing. Living with cancer is very difficult. Initial care is fantastic, but survivors still need support, as one can feel isolated when checkups are stretched further apart. This is where Coon Cancer Support Care has been a lifeline to myself and my wife. They offer a free and confidential service, even just for a chat. They offer free therapies, which are very beneficial to the cancer patient and their family members. And this cancer patient survivor said, a very grateful survivor and a very, very grateful Coon member. And I have numerous testimonials of the same, I suppose, passionate plea that Coon Cancer Service is supported and given the funding that it needs, Minister. As you know, and you've said yourself, that most centres like these, you know, they are run on the voluntary basis, and none of the volunteers are complaining about that. But the complaint is they need transparency, they need equitability, they need to know and to have a future and consistency and to be able to plan that they're going to have funding, Minister.
Thank you. Minister.
Thanks.
And again, thank you to the Deputy. And I suppose one of the things you said struck home to me about people having cancer and how important it is, even though people are recovering or have recovered, to have the support in the community. And I know myself in my own parish, we have a centre somewhat like that where people can go after being diagnosed with cancer through the cancer programme and when they come out the other end as well. And I suppose it's very important for a number of reasons. I know you mentioned a cup of tea, which is very important. I think the whole interaction between people who have had cancer and helping those who are in the process of it and coming out the other end. I don't know why, and I'm not sure whether Minister Harris would be would know neither why funding wasn't given under the National Lottery to this particular service. However, I will inform the Minister and see can anything be done. I can't give a commitment on that, but I do understand the need for the service, such like this, as I said, there's one myself on the South Circular Road where I live, and I think it's very relevant when I go there, sometimes even just to visit, when I go even for their coffee morning, the need that people can just sit down and talk to each other. And I suppose get support from each other, which is what community services should be about and is about as well. I don't have an answer for you on why funding wasn't given to this group, but I certainly will pursue it for you. And I will, if I don't come back to you myself, I will ask Minister Harris to come back to you himself.
Thank you very much,
Minister. I don't have any other
your
information.
Your commitment is appreciated.
Okay.